We go now to our reporter, Lora Windsor, who has more on treatment options for infertility.
If getting pregnant has been a challenge for you and your partner, you're not alone. 10 to 15% of couples in the United States are infertile, and both women and men can have problems that cause infertility. We spoke with Dr. N. Edward Dourron at Hoag Memorial Hospital Presbyterian in Newport Beach, who gives us more information on treatment options for infertility and at what point should a woman seek help.
A woman should seek help for infertility if she's attempted pregnancy for 12 months and she's under the age of 35. If she's over 35, our recommendation is that she seek help regarding fertility after 6 months of trying. Women over 40 should generally see a specialist if they're not pregnant within 3 months. The important aspect of infertility is that women should have regular periods, and if they're not having regular periods, they should seek the help of their OBGYN or a fertility specialist, because the chance of conceiving if they're not having regular periods is very low.
Dr. Dourron, how long does a couple try to get pregnant before going to a fertility specialist?
Most couples will come see a fertility specialist for treatment on average after trying for approximately 24 months. So it's not the recommended 12 months that we typically or that we would like to see. Patients often will remain with their OBGYN and be hopeful that somehow they're going to get pregnant. So generally there's a delay of 1 to 1.5 years from when they should see us to when they actually do see us. At the beginning of a fertility evaluation, we do 3 basic tests. The first is to evaluate the husband's sperm production through a semen analysis. Second, we will do a hysterosalpingogram, or an X-ray of the woman's fallopian tubes, to determine whether they are open or not. And finally, confirm that the woman is ovulating through ultrasound and hormone blood testing.
We asked Dr. Dourron what treatment options for infertility are available.
The treatment options that are available generally begin with fertility medications that can be either pills or injectable fertility hormones to increase the efficiency of ovulation. So we try to help women that either do not ovulate, or women that are ovulating and have unexplained infertility release more than 1 egg. Generally our goal is to have them ovulate anywhere between 2 and 4 eggs, and we combine that with insemination. Insemination is washing the husband's sperm and placing it in the uterus through a little catheter at the time of ovulation. If this treatment is not successful, sometimes we'll recommend laparoscopy surgery to diagnose and treat patients for endometriosis or scar tissue. The final treatment that we offer to patients is in vitro fertilization. And this is where we stimulate a woman's ovaries to produce multiple eggs with hormones, remove the eggs, and combine the eggs with the man's sperm in the laboratory. We create embryos that are then transferred into the uterus. This is the most effective fertility treatment that we offer.
How successful are the treatment options for infertility?
At this stage in fertility treatments, we are very successful. On average, 80% of patients that come to see us will go home with a baby. Especially if they're open to the options of advanced reproductive technologies, which include in vitro fertilization and donor egg in vitro fertilization.
Finding the cause of infertility can be a long and emotional process, and it takes time to complete the tests needed, but fortunately, there are many safe and effective treatment options for infertility. For the American Health Journal, I'm Lora Windsor.